For the last few years, the growing opioid crisis has prompted calls for a treatment facility in Franklin County. This May, a new treatment center will open under the direction of Dr. Ruth Potee, a family physician and addiction specialist. Connecting Point correspondent Carolee McGrath spoke with Dr. Potee and Marisa Hebble, the former director of the Franklin County Opioid Task Force, to learn more and to bring us up to date on this epidemic that's affecting cities and small towns alike statewide.
Franklin County was one of the few counties in Massachusetts that didn't have any longer-term stabilization treatment available, and so this is opening. It's run by a Springfield-based behavioral health network. We hope to be providing really evidence-based care and model better care that we think actually most places should be doing statewide. I think that addiction medicine is a funny branch of medicine where people feel as though if I got sober, you should do it the way I did it because that's my way or the highway attitude. And the truth is there are many ways that people can enter into the path of recovery. And so we hope to really be helping people with their medical needs and their trauma needs, help with housing. I mean, to be in recovery is a long, long journey, and that a month somewhere or 2 months somewhere is just the very first steps to getting better.
So tell us about the facility. It's 64 beds.
64 beds, 32 of sort of acute stabilization, so that's sometimes 4 to 7 days. And
is
then
that detox? Is that what that means?
The word is detox. I try never to use that word because this is a disease. If I told everybody you need a detox off of your diabetes meds, let's do that in 5 days, I mean, that's impossible. And it gives people the sense that you can make anybody better in 5 days, that there's anything about withdrawing the drug from your brain that improves you in 5 days. In fact, it makes you more vulnerable to relapse and to overdose. So I'm not a big fan of that concept. The truth is we're going to try to get people stable, ideally stabilized to medically assisted treatment, warm handoff to the community, and then really address in the early stages how it is we can get them into a sober living situation away from where the people and the places they used to use.
And will anybody be able to stay for longer than 4 to 5 days, or is there another part of that facility?
The second part of the facility then is the longer term stabilization, which at a minimum is 14 days, and for some people it'll be longer, but the whole time we'll be saying, what is our third step? You're here, you took your first step, we have a second step, where are we going to get you to go next? Because this is the path that it's going to take a while to get you to recovery.
Okay. Marisa, I know that you had headed up the task force in Franklin County, and now you're going to be working with the state. Tell me a little bit about what you will be doing.
So I'm going to be coordinating a project that is spearheaded by the trial court and Chief Justice Paula Carey in Massachusetts, but also in collaboration with the Department of Public Health and the Department of Mental Health, working with communities across the state to better connect the criminal justice system with the treatment system. So what we know is that people with substance use disorders and mental illness are overrepresented in the population in the criminal justice system, especially when compared with the general population. And the earlier that we can intervene and connect someone to community-based treatment and support, the better their outcomes are, the less likelihood they have of recycling through the criminal justice system, the less likelihood they have of penetrating deeper into the criminal justice system. So the earlier we can connect people. But also, if someone does end up in jail, making sure that when they're there, they have good treatment. We've got so many people who are in our houses of correction in Massachusetts who are young, heroin addicted, did something related to their addiction, and if we don't give them good treatment, the likelihood that they'll continue and they'll recidivate and get back into the criminal justice system is really high. And we've seen this real intersection between the criminal justice system and treatment, and we have to have our pathways all very connected, and we need to do a good job of getting people help.
And Dr. Potee, I know this is a very big question, but why? Why has this become such a big problem in the last several years?
I mean, addiction is not new.
No, but the opioid thing that we're all paying attention to. Although the opiate
problem has been a problem in many of our communities for decades, I just think that it's been swept under the rug, or it's been ignored because it's been in urban settings of people who didn't have as much power. And now it feels like this is a problem in every community out there, and so it's risen to the top. And my hope is that sort of the disease of addiction across the board, whether it's to alcohol or opiates or everything, rises to the top, because it's hard to find a family out there that doesn't have some pathway or some family member somewhere that has struggled with some sort of addiction. And the acknowledgement that we can all have that this is a place in the brain that breaks down, that can get better with the right treatment, is a shift in thinking. And you know, I went to expensive, good medical schools and residencies, places that were really good at addiction. I learned nothing about this during medical school or residency. A disease that affects 10 to 11% of Americans, more than type 2 diabetes. And I learned nothing about it in medical school or residency. How is that possible? How is it that we are training physicians out there who know nothing? And if I ask this question of a room full of physicians, they say the same thing. We know nothing about this and we don't know how to help people. So my hope is there's a shift across the board. One of the pieces of legislation recently passed by Governor Baker, who I think has done really great work on this. I'm always looking like I'm a negative person because I say we could be doing more. But one is to get curriculum on how to prescribe better for managing chronic pain. And I think that's important because chronic pain is complicated. Opiates are not the only solution for chronic pain. We would argue they haven't been a great solution for some people. But we have to get curriculum into all of our schools talking about addiction and how to help people with it. Because I don't know who they think these magic addiction doctors are out there who are going to fix all these problems. They don't exist. There's very few of us in the country.
And when this does happen to a family, and I know we have talked about this before, it's devastating. I mean, especially when a parent is trying to help a child and then the court gets involved and maybe there's grandchildren. It's a mess. It's a
very
mess. How do you help people navigate through this?
That's such a good question. Addiction is so complicated, not just for the person, but for the family. I mean, really, when a person enters recovery, hopefully they get connected with services, but the family needs to get into recovery as well. And that can be a really tall order. There can be a really complicated constellation of issues surrounding people, and families really need to all relearn how to be in relationship with each other. And we don't have a lot of support services for people that are ready to take them on demand when they're ready and they need it. I mean, I wish I could say that your first call is one direct call to every service that's going to help you and your family get better. And I think we're moving in that direction because so many people are paying attention to this crisis, but we're not there yet. We have a lot of work to do.
But the legal matters surrounding that are a big challenge, and I know that was something that you've worked a lot on. But like for a grandparent, for example, who wants to take custody of a 2-year-old because the mom has an addiction problem, it gets to be so complicated and hard for them, for families. Have you seen those situations?
Absolutely. I think that's one of the indicators that things were really on the rise in Franklin County, was because they were seeing so many guardianships, so many grandparents coming in to take guardianship of their grandchildren. And something interesting and innovative that's coming out of family court in Franklin County is a family drug court was just approved. And it's the first in the state, and it's one of the few nationwide that's really going to help not only the addicted person, but give support services to the parent or the person who's the caregiver who's coming in to take custody, and as well as the child, and really trauma-informed services. And this is something Dr. Potee talks about often, but we really have to think about trauma and what we're doing, and getting services around young people as quickly as possible so that they don't then become addicted themselves. Something Dr. Potee talks a lot about is opioids being able to quiet the part of the brain that experiences trauma, and if this is really prevention. So really, I mean, I think this family court and thinking about the young person and helping them with trauma is really significant.
So I was wondering what you think is the best way to prevent all of this. A friend of mine who lives out of state was telling me that one of the teenagers there was telling them that there's these new things called farm parties where the kids bring all these pills and they dump them in a bowl at a party, and they start doing their thing. How do you get the message to teenagers, and do you think there are gateways that leads to this risky behavior, marijuana being one of them?
I mean, we know that there are 3, likely 4 paths that will predispose somebody towards addiction. Genetics is huge. And telling your kids about what your family's genetic risk is critical. And that parents ignoring it, that they themselves have been in sobriety and thus their kids don't need to know that, your kids need to know that. Your kids would know if there were strong cancer genes in your family. And cancer genes have a very small role in actually predicting who's going to have cancer. So strong genetics, 50% of all addiction is genetic. The second thing is early exposure to any addictive substance, whether it's marijuana or nicotine or alcohol. And the earlier you use any of those 3 substances, the more likely you are to struggle with a lifetime of addiction. And so postponing use, alcohol, I look at my own 3 kids. I know the 3 of you are going to drink someday. I would like your first drink to be when you're 19, 20, or 21.
21.
Yeah, 21
Let's
would
go
be
with
better.
21.
21 would be fine, right? I'm trying to be realistic, but I don't want that first
Let's
drink
not
to
be
be at
realistic,
15,
21.
16, and 17. You want to do it when the brain is done developing. And marijuana, for all those people out there who think this is a benign, non-addictive drug, everything points the other way on that one. This is an addictive substance, particularly in the adolescent brain, that in an adult who starts using, 9% or less may get addicted to marijuana. In an adolescent, the numbers are 30 to 40%, but that is based on the old marijuana, which was much less potent than the stuff that we're seeing now. I mean, the potency of the THC in today's marijuana is somewhere between 9 and 16% in just the field-grown stuff, and then they intensify it. We have no idea what we're doing with marijuana, and I anticipate we're going to reflect back on what happened in 2016 and think, 30 years from now, what were we thinking? Because we will have created 2 or 3 generations of people who are struggling with levels of addiction, cognitive loss. I mean, an 8-point drop in IQ is what we see in every study over a period of time, and that's, again, with the old, poorer quality stuff, right? We have no way to predict where this is going. So very dangerous drug. Any addictive substance in early brain development phase is going to put you at risk. And then the final one is the one Marisa said, a history of trauma, childhood trauma in particular. There's no better way to sort of numb up psychological pain than alcohol or opiates or just wanting to check out. And what if those kids learned techniques to quiet down that fear and that sadness and that grief that were actually beneficial to them? And what can we do as adults to model it for them?
Thank you so much for joining us. This is a big topic. We could talk for hours and hours, but thank you both for all of the work that you're doing in the community.
Thank you for inviting us.